Hello, Bennett-Soulier syndrome. This is mostly an inherited autosomal recessive condition, also known as giant platelet syndrome. It is a disorder of platelet adhesion, so this is important, and this affects primary hemostasis. So this means that platelet plaque formation is affected. Then it's protein that's deficient is the glycoprotein 1b 9,5 protein. So it's just glycoprotein 1b, which then complexes with clotting factors 9 and 5. And so the deficiency of this protein affects the integrity of the membrane of the platelets, resulting in unstable platelets that can be easily leased, and this causes thrombocytopenia as well. Also, the reduced integrity of the platelet membrane causes the platelets to lose their shape and become macro thrombocytes. They become very big platelets. And the patients tend to present with mucocutaneous bleeding, so they tend to present with easy bruising. They also have mucus bleeding, so they bleed from their nose, from their gums. They tend to have excessive menstrual bleeding. Okay, the lab tests, if we do blood tests, when a full blood count, we'll be able to see the thrombocytopenia, and if we do a peripheral smear, we'll be able to see the giant platelets. There is also prolonged bleeding time, but there's normal platelet time and activated partial thromboplastin time. There's normal aggregation with ADP, since the aggregation is not affected, but there's reduced adhesion with ristocetin. Then flow cytometry will help to determine the deficient proteins on the platelets. So the treatment, if the patient is bleeding or in anticipation for a procedure, is to give platelet transfusions. Then there's also use of antifibrinolytics, such as tranexamic acid and aminocaproic acid. There's also use of desmopressin to try, it's shown to reduce the length of bleeding. Thank you.